Hello, I am Dr. Manusrut, consultant ENT surgeon at Apollo Hospitals, Jubilee Hills. Today I will be talking about a common condition in which patients suffer with hearing loss, and when they go to consult an ENT, on examination their eardrum is absolutely normal, and they go for a hearing test, and in the hearing test the nerve is also absolutely normal, but still they have hearing loss. So this is known as a conductive hearing loss, and it usually happens if there is a problem between your eardrum and the nerve. There are three small bones behind the eardrum which can get fixed or may not move properly, causing this conductive hearing loss. And the most common condition is called otosclerosis. Once you are diagnosed with this condition, you usually undergo a scan, which is a CT of your ear, which tells us how those bones are. So the treatment offered can be of two types. One is either you use an hearing aid, which is something which most of the patients don't prefer, but the best option is to undergo surgery. It is known as an endoscopic stapedectomy. So we go through the ear using an endoscope, we lift your eardrum and we check how these bones are, whether they are moving or not. And in this procedure, we check the mobility of each bone. These bones are very small, around 2 mm, and the last bone, if it is fixed, is replaced by artificial prosthesis, which is usually made of titanium. What this does is it helps in improving the conduction from the eardrum to your nerve, and thus improving your hearing. This is usually done as a day procedure. You can be discharged the same day. Some patients can have dizziness post-procedure, which can last anywhere from 1 day to 1 week. Patients can get back to their work after a week and usually have a very good hearing post-procedure. So if you have been diagnosed with otosclerosis, always consider for an endoscopic ear surgery, because this will give you better long-term results with good hearing compared to a hearing aid. To get more such clinical information, follow and subscribe.